Hey, Bulvin, and welcome to another episode of Health Talk with Oceania Hospitals. I'm your host, Alex. Let me like a massive nakavakaliv to everyone that have been following our social media pages and also right here on YouTube. A massive thanks for the subscriptions and the likes and the follows. Vinakavakaliv. Today with us in studio, we've got a very special guest, and she's none other than a very specialist here at Oceania Hospitals, Dr. Panel Emmy. Bulvinaka Doc, welcome to the show.
Bulvinaka Alex.
How are you?
Good, thank you.
Just before we start, could you tell us a bit about yourself and also your role as a senior consultant specialist physician here at Oceania Hospitals?
Thank you, Alex, and thank you for having me on your show this morning. I'm, as Alex said, Dr. Penwell Emmy. I'm from the western side of Fiji, from Nandanga, with links to rail, Northern Rail. I started my primary education at the Viyuta Primary School and then went on to secondary at Suva Grammar School. Ironically, I have an old boy from Marist, our rival school, interviewing me this morning. I finished high school and went on to a foundation science program at USP. And then I started medical school in Fiji School of Medicine. When I graduated, I did internship at the CWM hospital, and then I was posted for public health services at Taviuni Hospital. And whilst there, I also had a stint at Lambasa Hospital, Sausavu, and I looked after the outpost centers in Yavata and Yanuga. In Vanuatu. And then I got posted back after a year, got posted back to CWM to work in internal medicine, and I started my postgraduate program there too, and finished up my master's in internal medicine and worked through the ranks until I was accredited as a specialist physician. Yeah.
Well, thank you. That's quite interesting, and it's quite an inspiring journey as well, and I'm sure.
I've done work attachments to Rotuma and Bar Mission, and a few in Australia, New Zealand, Philippines, India, and Germany. So I've had exposures in different disciplines in those places. Yeah, I've been around here.
Like I said, it's quite an interesting and inspiring journey, and I'm sure a lot of the younger viewers who are probably planning or already pursuing a journey in this career path listening in as well. And it's a perfect segue to ask you this question: what types of services and procedures do you currently provide at the hospital in the area of internal medicine?
Okay. First of all, I have to define what is internal medicine. Because everybody knows surgeons, everybody knows gynecologists, obstetricians that service women's health and pediatrics. These are the four main disciplines. Internal medicine encompasses a specialty that practices in systems and processes of the body, especially so in adults. Adults that does not need surgical intervention or may need surgical intervention, but the primary aim is to service what is diseased in the systems of the body. And like the word disease itself, if you tease it apart, it's dis-ease, so the body have their own. I always compare the body to a house. You have the infrastructure, the frame, and then you have the fittings, then you have the furnitures. The fittings and the furniture. So the infrastructure itself is anatomy, and the processes going on in the body is physiology. So most of what internal medicine services is the dis-ease of the processes of the organs, the fittings, and the structure of the body. Okay? Whereas the surgeons will cut organs that are diseased, that are broken, or they'll repair and they'll reconstruct. We actually work on the functions, the electricity, the water that's flowing within the house. We do that with vessels and things like that. So we work on processes. Keeping that in mind, we have the organ systems, cardiovascular medicine, which deals with the heart. So we service in diagnose. I'm sure Dr. Rakesh has talked about that. When there's heart attacks, there's valve problems, there's wall problems, and there's rhythm problems in the heart. We got the modalities to actually investigate these diseases and treat them accordingly, diagnose and treat them accordingly. Then I service those that come with respiratory disorders, pneumonias, asthmas, chronic lung diseases, the gastro people that have chronic gut problems, and we've got the modalities for investigation of these patients and then the treatment forms. And that's the benefit of being in a private institute. You are not restricted in terms of the modalities that you can offer, and we can expand, as is. Then there's the hematological disorders, the blood disorders, where they have the anemias, they can have blood cancers or different types of ailments that affects the blood systems in the body. And then we also deal with certain cancers, and we have the modalities to once again investigate. So I work in servicing the disease of the organ systems and the processes that go within the body. You got that? Okay.
I got it, and I'm pretty sure.
But our service is integrated with the surgeons too, integrated with the gynecologists and obstetricians. We work together on many units pretty much every day. Yeah.
It's a pretty comprehensive explanation, and I'm sure everyone's watching at home. You probably understand, but if you don't, you can always reach out to us if you have any queries or questions. We'll be more than happy to answer. So drop a comment if you have any queries on the topic that we're sharing today. So just to continue,
you just had a crash course in anatomy and physiology, which took us 6 years.
Yes.
Which took us 6 years.
But I'm not ready yet.
Yeah.
With your extensive background, doctor, in both public and private healthcare,
yeah,
how has your experience shaped the way you care for patients today?
Okay. Well, I started in the public system in Ministry of Health, and I've done work in and around the periphery and the main hospitals, and I trained also in the certain disciplines, and then I've come to the private hospital. Okay, how it shaped my my mode of treatment and care, duty of care. One is when I work in the public system, I've got to engage best practice, and especially so in the use of resources, because it's not as readily available or affluent like in a private hospital, and it's made me having to really practice clinical, standardized, and work within boundaries. So I can get limited in terms of servicing certain diseases while working in the public hospital, whereas in private hospital, it's right there before us in terms of diagnostics and therapeutic. There's plentiful, it's bountiful in terms of what I could do. I could take care to another level because of the resources that's available. So in public hospitals, in the public system, I have to practice with care within boundaries of confinement, especially so resource-wise. In the private sector, I can go all out and actually, just practice, diagnose, investigate, and then, even I have the liberty of sending patients abroad for further subspecialty care. So that's sort of, so when I'm attending to a case, I'm looking at it as is it a case from the public that, that needs a bit more care, confinement, planning in terms of the program I'm going to service the patient with. And in the private hospital, I also do that. There's care. We don't just work anyhow and spend as much as we can. But I have more options in the private practice. Yeah.
Thank you. Just before we wrap up, what message would you like to share with our viewers about the importance of early medical checkups and specialist consultations?
All right. Okay. I think Dr. Malani would have shared a Medscape podcast that's already it has journal meta-analysis, and in that podcast the journals actually spoke about genetics as a predisposing risk factor in terms of NCD load. NCD, that's when you talk hypertension, diabetes, all the NCD type diseases. Those are the studies like a couple of years back. 30% is contributed by our genetics, what we've inherited in terms of illness from our parents and our forefathers. The revised version of that study now, it's gone down to 7%, which means only 7% of the diseases in NCD that we're afflicted with are caused by genetics. The risk factor is genetics. That means 93% is lifestyle. Most of the diseases, it's provoked, it's exposed with lifestyle. Yeah, and I remember there was a general discussion that we had. In the second decade of life, you're basically determining your risk of getting NCDs. So meaning, like, as you go past from childhood, 10 years and above, you're setting the pace in terms of lifestyle. So the control begins right from early on, adolescent period up until adulthood. Lifestyle, we just can't overemphasize lifestyle. It's got to change, and in this fast-paced world where everybody has so much obligations, their health doesn't take precedence. Yeah, and the wealth of a nation depends on the health of its citizen. You believe that?
It's true.
Yeah. You can't have a sick population and expect to economically develop. Yeah. So, my advice, I think that's the next question. My advice is lifestyle's got to be modified. It's got to be disciplined, and just take care of your health. And in terms of early diagnostics with specialists, it depends on the doctors in the periphery. The quicker they can pick up your symptoms, can associate it with something that's chronic or life-threatening, the quicker you can get the services. And in terms of specialist services, our hospital has them all. Yeah. Except for ENT, I think. Yeah, but we can offer a lot more in terms of diagnostic, and then we can give you options in terms of therapeutic.
Thank you. And there you have it, ladies and gentlemen. A word of advice from Dr. Emi is your lifestyle. And always remember 5:30, 5 servings of fresh fruits and vegetables a day, 30 minutes of physical exercise. And I think right about now, straight after this, I'm going to go for a walk for about 20 minutes or 30 minutes, and I'm going to get back to the office. But until next week, right here on Health Talk with Oceania Hospitals, Nakava.
Thank you.